Welcome back, friends. Thanks for sticking with us. You know, catching breast cancer early can save lives, and one way to do so is to get regular screenings as part of preventative care. Today, Dr. Zoe Larned, Medical Director for Ochsner MD Anderson Cancer Center, is here to talk about understanding your individual risk and the importance of mammograms. Happy Breast Cancer Awareness Month.
Thanks, nice to see you.
Good to see you. Thank you so much for coming on. And, you know, we're talking about breast cancer all throughout this month, as we should be, right? But I really want to let people know a little bit more about what happens when somebody actually develops breast cancer. What is happening?
Absolutely. So the most important thing that patients should know is that once you get the diagnosis of breast cancer, there's a medical team available to help you through each step. Every woman's breast cancer is unique, and what we want to understand is who is needed to help cure you and treat you successfully for that cancer. Obviously, early screening is important, so maintaining your annual mammograms. Once you have the diagnosis of breast cancer, we'll walk you through what the treatment might look like. For some women, it's surgery and monitoring after. For some women, it's certain treatments that are required systemically that can range from pills to systemic chemotherapy at different phases during that. The most important thing is to develop a team approach, meaning that you want people to help navigate you through the care. You want to know what team members are needed, whether it's the radiation doctor, the medical oncology doctor, and the surgeons, and we help you with all that from the first visit.
And you all are actually celebrating 1 year of your partnership with MD Anderson Cancer Center. Congratulations on that. But I want to really go back again to talking about what's happening with breast cancer. On the cellular level, like what is happening there?
So there's lots of different risk factors for the development of breast cancer. What we do know that in an average woman's lifetime, there's about a 13% or 1 in 8 chance of developing breast cancer. For some women, that risk is higher based on other factors, including genetic factors, family history factors, personal factors. We help women work through and understand what that is. But basically what cancer means is there's a cell that's grown unchecked by our normal immune system. And when that occurs, it often will need some treatment so that we can get a patient to a successful cure. The great news about breast cancer is most women are diagnosed at a curative state, especially when they do the appropriate testing, and we help you with that. We also know more and more about breast cancer, so we can help women know when they should test, if their testing strategy would be different for screening, and we also have better therapy. So we talk about the fact that there's lots of different types of breast cancer. Every one is unique, but we know how to steer treatment to the different.
And you know, we showed a couple of the risk factors moments ago because yes, everyone can be at risk, but there are some women who are more at risk. One that I really want to talk to you about, Dr. Larned, never having children or being pregnant after the age of 30. What's happening there?
So it's interesting with breast cancer, there is some hormonal influence, so hormonal exposure over a lifetime, whether it comes from when you've decided to have pregnancies or if you've ever taken any type of hormonal replacement or oral contraceptive therapy. I know that that sounds scary when women hear about it. Listen, I'm a mom that had children later. The truth of the matter is, the truth of the matter is there's lots of different risk factors for breast cancer, but all of them can be addressed if you have your screening mammography on time as recommended by your physicians.
It's so true.
So we don't want those things to be scary to women. Instead, what we want them to know is they can own those and really manage it well.
And really just be aware, because a lot of people know about family history. Ask your moms, your grandmothers, your aunts, you know, do we have a family history of breast cancer? But breast density is also another thing that I did not know about as a possible risk factor. What's happening there?
Well, it's part of your scoring, and so it's also a little more challenging sometimes to read the imaging based on breast density. The good news is mammography is better than it ever has been. And we also have additional imaging that can be done, including breast MRI. So once we determine what a woman's risk factor may be based on personal factors, family history, if there's any genetics involved here, then we're able to really determine what the best strategy for screening is. Maybe it's more frequently than once a year. Maybe it starts earlier than age 40. We will help everyone navigate that for them personally.
And you know, unfortunately, Dr. Larned, there could be somebody watching this right now who has never had a mammogram before because of reasonings like, it's scary, I just don't know what it looks like. So let's talk about what a mammogram appointment looks like.
Okay, so the first thing about a mammogram appointment is they're going to get some basic history, really to help risk stratify your chances of getting a breast cancer. So they're actually going to ask questions about family history, pregnancy, breastfeeding, oral contraceptive use, hormone replacement therapy, that can be very helpful to the mammographer in determining if any additional imaging is needed as well. The second thing is you're going to prepare for an imaging test to be done of the breast. I will say there's some slight discomfort, but I've never seen significant pain related to that. I've obviously done several myself. The radiologists that work you through that process are incredible. They explain each step of the way and why the images are being done a certain way. They will communicate with you if any additional imaging is needed at that time. It is nothing to be afraid of. What I would say I find is harder is to remember to get them on time. A year goes by very quickly.
It does.
So a lot of women will actually plan it around their birthday. That way it's an easy reminder that it's time to go and get my mammogram. Now we'll send out reminders to come and get your mammogram as well.
You all are celebrating 1 year Ochsner in the partnership with MD Anderson Cancer Center. Congratulations.
Thank you.
You all have helped out so many people. And one way you all are able to continue to help people is through fundraising. You all have an event at the Caesars Superdome. I've heard all about this Moonlight and Miracles Gala, but I have never been. Talk to me about what we can expect this year.
It's incredible. This is our 12th annual gala. Mrs. Gail Benson is the chair. We have dancing, music, food, but obviously the biggest goal of this is to really raise money for the cancer patients. So our job is to not only get them access to the most innovative treatments, the most innovative clinical trials, any type of socioeconomic support that they need. It's really to be a differentiator in the care for these patients.
It's so important.
We're excited.
For more information about breast cancer prevention, you can log on to ochsner.org/incancer. And don't forget that Moonlight and Miracles Gala is coming up on November 15th from 6 p.m. to 10 p.m. at the Caesars Superdome. To get your tickets, log on to ochsner.org/moonlight. All right, stick with us, everybody. We have a lot coming up on Great Day. Don't move. We'll be right back.